it reversible? Is it, once you start, can you stop? Those types of things.
Yeah.
And if it's completely alien to them, then I suppose you can kind of understand that reaction, can't you?
Because I was frightened. I was frightened of them not accepting me.
Yeah.
I was frightened of them being scared about what was ahead for me. Why can people not just accept me for who I am and use my correct name or pronouns?
Good afternoon. Welcome to the Great Schools Trust podcast called The Great in You. My name's Stephen Panter and I'm your host for today. And you'll be pleased to know that we've got back a fantastic guest that we had a couple of episodes ago, Christian Owens. And Christian, we had a really long podcast last time, but we actually had things that we didn't even touch on, we didn't even talk about. So I'd like to welcome Christian back again. And I know those that have watched the first episode will have been really interested in that conversation. It was so enlightening, really, in the world of kind of transgender and Christian's career and everything that he experienced growing up. So welcome back, Christian, and great to have you here again.
Thank you very much. It's great to be back.
And, we said we'd bring you back and, I'm hoping that people have watched the first episode. They don't jump to this episode and wonder what's going on.
Yeah.
So today we talked last time, didn't we, about there were things that we didn't touch on with regards to kind of your experience, especially around kind of how your journey impacted your family, how that kind of ended up, your relationship with your dad and your mum and your siblings. We didn't really go into loads of detail around that, but that was really significant in your journey, wasn't it?
It was, yeah.
So we're going to talk about that today. And we're also going to talk about kind of your physical journey as well, because I think we said last time, didn't we, that, and I've known you talk about this before in front of audiences, and it's something that really interests people because it's, well, how do you physically transition? How do you go about that? What are the ins and outs? What do you feel at the time? What's going on for you in your head? During the operations and during that actual the physical, if you like, the development within that transgender kind of area.
Yeah.
So I don't know which area you want to start on. If you want to start on kind of the family aspect of things and kind of what happened, how you what the impact was with regards to family members.
Yeah, and I think the two naturally interlink.
Yeah.
Because my family has been part of the journey, and it was difficult very much at the beginning. So for me, I first presented at the GP in 2011 to seek that initial support and referral, I suppose, because I always knew, because of what we touched on in the last episode, my journey from childhood, I always knew for me, my personal journey, it was going to be a medical transition.
Yeah.
Because of the dysphoria that I felt and because of the need to complete myself physically. So I turned up to the GP in 2011, so I was 40 years of age, and it was probably something that I'd been waiting all my life to do. And I got that initial support there, and a referral was made to the gender clinic. And in 2012, I started hormone therapy.
Okay.
So at that point, that was the pivotal moment that I knew I needed to talk to my parents about it.
Yeah.
Because I knew I was going to start to physically change. And looking at it now, with hindsight, I think you think the changes are going to happen a lot more
instantly.
quickly
Yeah.
than they actually do, but it doesn't happen like that at all.
Yeah.
You certainly don't go to bed and wake up the next morning and you've got a beard and, you look like this. But I thought I need to tell my mum and dad, and, and also I wanted to get that family support behind me, because I knew it was going to be a long journey.
What were the feelings around that time? Can you explain to people what that felt like?
It was daunting. It was daunting for me to actually, that journey to go and tell my parents. I can remember it clearly. It was August Bank Holiday Monday 2012, and I was going to be kind of starting testosterone, and I thought, I need to tell them. I'd obviously tried to tell them many times before, and I'd always just, left and not done it. Because I was frightened. I was frightened of them not accepting me.
Yeah.
I was frightened of them being scared about what was ahead for me.
Yeah.
Because they're my parents and they love me.
Of course.
But on this particular day, I had to tell them. And it's probably one of the most difficult things that I've ever had to do. And I was there for about 2 hours in the living room. And we talked about everything other than what I needed to talk about. And then I thought, no, just do it. And, that day I didn't get the reaction that I was really hoping for.
Okay.
And at the time I didn't really understand that, but hindsight is a great thing.
Yeah.
My dad didn't really say anything. And my mum just looked at my dad and said, your dad's never going to cope with this. And then when I left the house that day, my mum just said, but I thought you were happy. And so it was clear that they just didn't want me to go through this journey. Not because they didn't want me to be happy,
Yeah.
but because they were frightened for me,
Yeah.
And that fear probably came from a place of not understanding.
Yeah, I was just going to say that it is probably about their understanding, isn't it? And
Yeah.
like you say, they might jump obviously to the most worrying aspect. Well, what if things go wrong? Is it? People say things like, is it reversible? Is it, once you start, can you stop? Those types of things.
Yeah.
And if it's completely alien to them, then I suppose you can kind of understand that reaction, can't you?
Absolutely. Looking back at it now, I think right there in that moment, I just wanted acceptance.
Yeah.
I just wanted them to just accept everything that I'd said, and everything would be fine.
Yeah.
But then when I look back now, I think that was such a big piece of news that I gave them that day.
Huge.
It was huge, wasn't it?
Yeah.
And, people have to process that, particularly the people closest to you.
Yeah.
And also my parents are older,
Yeah.
of a different generation.
Yeah.
They didn't really know what to expect. And I think there was, I don't know, just maybe a little bit of guilt as well on their part. Is this because of us that our child is having to go through this journey?
Yeah.
And also all of those things that probably go through your head. What are we going to tell the neighbours?
Yeah.
What will people think? There's so many things.
What's interesting is as you were talking, and I'm thinking, the age of your parents. What will they think? What will people think? Probably you're kind of covering all those things that people would automatically think. Do you remember thinking like this at the time, or was the priority just for you just to go, I've got this. I need to tell you. I need to tell you what's.
That's
and you didn't
exactly.
really think about the impact and the.
No,
Yeah.
and you know what? Sometimes I actually describe it to people as feeling quite selfish as a person, because I had this journey that I had to go on. I had this news to tell them, and that was the only thing on my mind.
Yeah.
But sometimes in life, particularly in a life journey like this, you have to kind of preserve yourself
Of course, yeah.
a little bit.
Yeah.
And although it seems selfish to me now when I look back,
Yeah.
I had to do that because I had to get through this journey, come what may.
Well, if you think about, as you're talking and as we've spoken before, you think about young people. I deal with young people quite a lot, and sometimes they will disclose things, and they will build up and build up and build up to that point of disclosure. And that's what you did, didn't you? You built up to that point of disclosure, and you just had to go. But I describe it when I deliver training in safeguarding as well. Is once that goes like that, it's like you almost want to pull it back in. So you see it in our young people are like, they're frightened to death of the consequences of what they've said.
Yeah.
And it sounds a little bit like that's what you went through. That's what you experienced.
Yeah. It's like I had to get it out.
Yeah.
And in a way it felt like a relief.
Yeah.
To get it out. But then it was all of the kind of consequences that
Mixed emotions
that came from that. When I left their house that day, I didn't know what was going to happen.
No.
I walked down the path that day and lots of things went through my mind. Will I ever see my mum and dad again?
Yeah.
Do they still love me?
Yeah.
How am I going to protect them through this journey?
Yeah.
And are we going to talk about it, or is it just going to become this silent subject?
Yeah.
So there were so many things going on for all of us.
Yeah. Because actually you started that process and you felt so compelled to tell those closest to you, that when you know, hoping to bring people closer to you. And it sounds like what it did in that initial stage is it made you feel like you push people away almost. Is that fair to say that?
That's how I would describe it.
Yeah.
Although I continued to have a relationship with my mum and dad after that news, it was a little bit stunted.
Yeah.
Sometimes I described it as kind of feeling like I was on the outside looking in.
Yeah.
So I would continue to go because, you know, I love my parents, I love my family, but I'd feel like the elephant in the room.
Yeah.
Because they didn't really, and again, this is something that I now look back, and I think they didn't really have the tools.
Yeah.
They weren't equipped to really know how to engage with me about this journey because, you know, my parents didn't have a smartphone or a computer.
Yeah.
They couldn't Google anything about the subject, what I was going through. They were just reliant on what they were reading in the newspapers, which isn't even a good thing sometimes.
Quite a lot of that's negative, isn't it?
Yeah.
People build their knowledge and their perception from you know, negative things that people write about people in your situation.
Yeah, but that's all they had.
Yeah.
Do you know? So I think because of that, the conversations were very, it was almost like we skirted around the subject. And
did you sometimes want people to go, ask me?
Yeah.
I know we've discussed this before, haven't we? Yeah. Ask me any question, you know, ask me and I'll tell you what I'm feeling. Did you feel the same with your family initially, or?
I did, because I wanted them to be part of this life-changing journey.
Yeah.
But at the same time, I knew that they were going on a different journey to me.
Yeah.
They were going on a journey of bereavement, of loss, of grief. I was starting a journey of this life-changing, enlightening experience of becoming me.
Yeah.
And the two are very different.
Of course they are.
You know, so you have to, I suppose you have to give people time in those situations, and I suppose that's what I did.
Yeah.
So we'd go round, we'd talk about everyday things, but we didn't talk about transition. We didn't talk about the medical intervention that I was experiencing. We didn't talk about the surgeries.
Can I ask as well, so obviously you've spoken about your mum and dad. What about the circle kind of around your mum and dad, you know, your siblings, things like that? You know, you're obviously aware of being that elephant in the room, but when you've got siblings as well, it makes it, you know, were any of them giving their opinion? Did they find out from you or from your mum and dad, or what did that situation look like, and did that make you feel any worse or any better?
I think we're a very small family, you know, so a very kind of small network. I'm very, very private as well. We're very private people. So my mum and dad didn't necessarily talk about it within the family.
Okay.
And again, I just think it's because they didn't really know how to. They weren't confident. So having siblings, and again, only, you know, a small family, but having siblings, it did give me that support. And I was actually thinking about it this morning, because I'm very fortunate to have a twin.
Yeah.
And we've been close throughout life. And although she found the journey herself difficult to come to terms with at the beginning, because of loss and because of grief, she became such a big supporter. So she was the person that then helped me with my parents.
Right, okay.
With the understanding and with the, do you know, the subtle corrections?
Yeah.
So when they would refer to me by my birth name, or female pronouns, she would be my champion that would say, do you mean Christian? Yeah. Do you mean him? Yeah. And it was just a very slow, subtle approach.
That sounds subtle, doesn't it? Because I think if your parents were being corrected all the time and almost being chastised for not grasping and not saying the right thing and not, you know, I think that's something that people that have had no exposure to this, that they would struggle with. Well, I don't know what to say. I don't know what to, how do I, and it's that kind of fear of saying the wrong thing. It's not the fear. It's not the acceptance side of things. Quite a lot of people, I think, are accepting.
Yeah.
It's just, I'm just frightened of saying the wrong. And when I first joined, went to a high school, I supported a couple of young people through transition, obviously at a younger age, so not full transition, but you'd constantly put your foot in it, and say the wrong pronoun and say the wrong, and you get some people out there that are like, oh, pronouns and all this, the kind of people that are anti against it and don't believe in it at all. But there's a lot of people that kind of do want to do the right thing and say the right thing.
Yeah.
So you kind of understand it, don't you, from your parents' point of view. But what's interesting there is your sister sounded like she did it in the do you mean? And it seems like it was nice, and it was like, and it almost that kind of reiterating it, just so it kind of gradually just, right, okay, and then it became kind of, I'm guessing it became kind of, normal then for them.
Yeah, more naturally. It was like that drip feed effect, it was just slowly, because we knew it had to be done slowly. We had to be patient.
Yeah.
Something I've learned a lot about my journey is that I've needed to be patient with people, particularly those that are closest to me, because otherwise, like you've just described there, there becomes a bit of defensiveness and like you're being chastised, and you don't want that.
No.
You just want to do it slowly, and hopefully everybody will come round to it.
Yeah. So cards on the table then. Do you, although you had to be patient, has it kind of frustrated you at times? Has it, or have you always, because you seem really reflective on the situation now. I'm just wondering, have you always been like that, so patient and reflective and knowledgeable of your own situation?
I think when you're in the actual moment and when it's happening, I think there is a little bit of frustration, and a little bit of why can people not just accept me for who I am and use my correct name or pronouns. It's only really now that I've been on the journey and there is that reflection, because I've learned a lot about myself.
Absolutely, I'm sure you have,
as well as other people. And it's also helped me with my journey as a transgender speaker, because I'm able now to talk to people through the lens of my own experiences.
Yeah, absolutely.
So when I speak to parents or carers and siblings, it's like, it's just take your time. Don't beat yourself up. You've been used to this person for however many years. And that's exactly now how I look at it with my parents. But in the moment and at the time, you want everything to go a lot more, more quickly than it is actually happening.
Well, it must be everything, mustn't it? The way people react to you, the way people communicate with you, where your family are with you, the physical aspect of the transition as well. It must be such a long, because I don't know what you're like, but I struggle to wait for things, like I'm like, like if it's taking too long, I get a bit kind of, frustrated with things and a bit.
That's it. And you don't, when you start this journey of transition, I don't think you truly know how long it takes and what's involved. But, it takes years and years and years. So, and you can't speed that up.
No.
And, when people ask me for advice now about particularly the medical journey, I just always say to them, don't jump ahead of yourself. Celebrate the wins that you're having, stages that you've got through, and then move on to the next one. But don't try to get to the finish line before you're ready to,
Yeah, thanks for kind of sharing that as well, because I think there will be people out there that have got a young person close to them, or even an older person, that's transitioning and have passed that news on and given that news, and lots of people out there will be struggling, as you've described, to process it, to understand, that it's not their fault, it's not about them, it's about the person themselves, And I think when you support, like I say, I've supported a couple of young people through that, and it's to me personally, and I've said this, in the work that I do, if you work with a young person that starts that journey and does it publicly, I always describe it as a young person in a school, they're doing it in front of 1,200 people. And to me, it's one of the bravest things that you can, if you support somebody in that journey, it's one of the bravest things I think you can see a person do. And I think, to me, that's why I'm That's why I love talking to you, because you're such an advocate. You're an advocate of young people, but you're so open about your journey, and I think people can really learn from, rather than judge straight away and not understand the intricacies of your journey and other people's journeys as well.
Yeah.
It's a tough thing, isn't it? It's a challenge, but that's why it's such a brave, because you feel so compelled. This is who you are and where you want to be and what you want to be known as, and how you feel, and so it's, to me, it's
it's such a strong feeling within you.
Yeah.
We all want to be our authentic selves,
Of course,
don't we?
Yeah.
We all want to bring our authenticity into the world every day, and you're kind of constantly thinking about that.
Yeah.
But you're also thinking, well, particularly with family, you're taking something away from them.
Yeah.
Because I'm not the person I used to be.
Yeah.
There's probably a little piece of that person still within me.
Yeah.
But I'm completely different.
Yeah.
Both physically, but emotionally as well.
Yeah.
And those people close to me have had to go through that loss, and and we have had separation within the family during that time where it's difficult for everybody involved, and particularly, for me, one of the biggest losses was my twin sister.
Yeah.
Because we were so close, she struggled so much with losing the twin sister that she'd had for over 40 years.
Yeah.
And it wasn't until quite a few years into transition when we got back on track with things, and she did become, a huge kind of champion and supporter of mine. But we went out for a walk one day and we talked about her feelings.
Yeah.
So that's given me the insight into the journey of somebody else, a family member, a sibling.
And I think that's important, isn't it? Because I think as a transgender person, you wouldn't want to be dismissed, in that journey. And that's the same for the family members and the friends and people that are trying to come to grips with what's actually happening here. And I think some people will dismiss them and say, actually, your feelings are not validated. But there's a lot of feelings in this situation, isn't there? And things to process.
Yeah.
And I think that, that validation, I think, is really important.
It is. And sometimes I think, I did a presentation yesterday and somebody asked me about, was the support there for your family members? Well, there wasn't really.
No.
They didn't really have anywhere to go.
Yeah.
So it did take time. It took years to process, to come to terms with. But when I listened to my twin sister explain it to me, it's almost like the penny dropped.
Yeah.
And I kind of understood it more.
Yeah.
She said...
What did she say? Can you share any of that?
Yeah, and, she won't mind me sharing it. We still talk about it now.
Yeah.
And we went to Formby Beach and we walked along the beach and we talked openly and honestly with each other. And she said, I had to leave your life. I had to walk away from you because I had to grieve for you, because I'd lost you. And just hearing her words, I thought, wow, she gave me that insight because she was just so open and honest. Yeah. It made me feel quite emotional. It still does, to be honest. Yeah. And she said, I lost you because you're not the same person now. Mm. She also went on to say, I remember you saying to me when you first told me you were going to transition, she said, don't worry because I'll still be the same person. And you're not.
You're not, yeah.
And I thought, wow, because we say these things at the time to try and help other people.
Yeah.
But she's right, I'm not the same person, and she had to grieve for the loss of that person. Also, what was really interesting about what she said was she was also apprehensive and anxious about whether she'd actually like the person I'd become.
Right, okay.
Christian.
Yeah.
And I'd never thought about it like that.
No.
It's almost like you're getting to know a whole new person.
Yeah.
And I'm not sure whether I'm going to like him or not.
Yeah. And do you actually feel completely different? Are there parts of you that feel the same in a way?
I think I do feel completely different.
Yeah.
Yeah. It's almost like I've been reborn.
Yeah.
As this new person.
Because that's hard, isn't it? For people. I mean, people might watch this that have had no exposure to this at all in their lives. They might have read the newspapers. All right. For people to understand that, I think would be difficult for some people, wouldn't it? I know what you're saying. I know where you're coming from because I've had some of that exposure. I'm not an expert. But I'm open to understand that and to. Whereas some people would dismiss that and go, "What are you talking about? Like you're the same person." You know, some people would dismiss it, wouldn't they? So
Yeah.
how would you describe what that feels like?
I think because now I've become me.
Yeah.
After many, many years, and because it has been such a long, slow process, it's almost like I've gone through it in stages and felt myself changing.
Yeah.
And I don't recognise my former self anymore. And that isn't just physically because I look nothing like my former self anymore, but emotionally I feel so much more in control of who I am. I feel so much more confident. You know, I feel like I'm living my life fully.
Yeah.
You know, I'm reaching my full potential. I'm confident. And that's why I don't recognise my former self because I was
Because you were none of those things.
I was none of those things.
Yeah.
I was lacking in self-esteem. I had no self-confidence.
Yeah.
I used to kind of hide in the shadows, hope that nobody would ever notice me. You know, I could never speak up in a crowd of people.
Yeah.
And I wasn't achieving. I wasn't me.
You weren't kind of flourishing.
I wasn't growing. I wasn't flourishing. And
a good friend that's been on the podcast, Liz, talks about languishing.
yeah,
You know, at a certain level, but then also flourishing. You know, so are you getting the best from yourself every day? And it sounds like your work's pretty, you know, kind of enhances that a lot because you're able to talk publicly, you're able to teach other people, you're able to share your insights and your experiences.
Yeah,
I think that's a big.
It's motivational, isn't it?
Of course, yeah.
You know, my business, Gender Space UK, as a speaker.
Yeah.
That motivates me.
Of course.
Do you know, every day I get up and I want to share these experiences because I know each and every time I do, I touch people's lives.
Yeah.
I touch people's lives and they walk away knowing something that they didn't know.
Yeah.
And something that they can share with other people.
I remember the first time you presented at the college when I first kind of met you, and we had a room full of teaching staff, support staff, and there wasn't a dry eye in the room, and people were so interested, but so open as well, open to learn and openly interested. And then they started asking questions about about kind of the physical aspect of it, like what does which brings us nicely onto that side of things, really. So I'm just gonna let you kind of put it out on the table, not literally, but actually, what the physical transformation that you've gone through? Can you give our watchers and listeners some insight into what happens? What do you go through? What discussions do you have? Who do you speak to? What are you thinking about? What's important to you as well?
Yeah. Because the physical side of the journey for some people, not all trans people, but for some people, including me, is a big part of the journey. And, like I said earlier, for me, I always knew that I was going to have to go through full medical and surgical transition because of my dysphoria.
Yeah. Can I ask how you knew that? Can you share that? How have you got that conviction that that's what you must do? Because I know some people will struggle with that on this journey. Yeah. Do I go the whole journey, or am I happy presenting in a certain way but not having some of the physical attributes? Tell me what that feels like, that kind of conviction.
Yeah, and it's funny because after I reflected on the last episode, I thought, I didn't mention this particular part. And it was when I was a child growing up and started to identify as a boy. I always felt like a boy. I was also very aware of my body, as you are when you're a young child, and your body parts. Yeah. And I felt like I'd been born without a body part.
Right.
And that is exactly how I described it when I reached Leeds Gender Identity Clinic to start my medical journey.
Tavistock, is it?
Mine was in Leeds, so there is Tavistock as well for kind of younger people.
Oh, okay.
And I spoke to a psychiatrist there, and he asked me to describe how I felt in childhood, and that's how I described it to him. I said I felt like I'd been born without a penis,
Yeah.
and I wanted to be like every other little boy, and that feeling never left me. In fact, it became stronger and stronger and stronger through adulthood.
Yeah.
So for me, I always knew that I was going to have to go through full medical transition, because I had to complete myself, and I had to reduce the dysphoria that I was feeling.
Yeah. So sorry to interrupt you again. For some of our listeners and our watchers and our viewers, what do you mean by dysphoria? What
Yeah.
how would you explain what that is?
So that
Putting you under the cosh, aren't I, today? but I want to educate as well, you know.
absolutely, and sometimes I'll use language, and because this is part of my
Of
life,
course, yeah.
and I just assume everybody knows what I'm talking about. But it's that feeling of discomfort,
Yeah.
or as I often say in schools, if I'm talking to young people, unhappiness
Yeah.
at your body, and for me, in my case, that lack of body part,
Yeah.
it gave me distress. It made me unhappy.
Yeah.
And
It must be quite profound, that feeling. It's because there's different levels, isn't there? But that must, it must be really high dysphoria.
Oh yeah.
And that it must kind of overtake a lot of other emotions as well.
Yeah, and I think it's really important to say that not every trans or non-binary person will experience dysphoria,
No.
because we're very different, unique people.
Of course.
We go on different journeys, but for me, my levels of dysphoria were high from childhood throughout, adulthood. And I knew that I had to do something about it because it was making me so unhappy. And it was causing me so much distress. So that's the path that I went on, and I got my referral from Leeds to start surgery. And my first stage of surgery was full chest reconstruction, which took place in 2014. So I had that surgery, and that was the beginning of a long road, really, of surgeries and complications. I was thinking about it, this morning when I was thinking about what we were going to be talking about, and I thought, I presented at the GP in 2011. I started testosterone in 2012. I reached Leeds Clinic in 2013. I had chest surgery in 2014. And I was discharged from Leeds in 2020. I didn't actually complete surgery until 2022. So from presentation at the GP to finishing surgery, it's 11 years.
10, 11 years, yeah.
And, again, that's that journey that your family are on with you as well, trying to provide that support. But obviously after chest surgery, I went on to have lower surgery, which was the most significant surgery for me. So that's called phalloplasty for trans men. But there's various types of phalloplasty that you can have. I had abdominal phalloplasty, and that was done over 5 stages of surgery that took almost 6 years.
So 5 for all 3? 5 stages, or 5 stages for each one?
So 5 stages of surgery for lower surgery. So you'd go for your first stage,
right,
and then you'd have time to recover. Sometimes there could be 18 months in between.
Wow.
The next stage of surgery. And that's just because it's so complex.
Yeah.
Lower surgery for trans men, as you can imagine, you're adding kind of body parts and blood supplies and various parts of your body are used. Like I've used my arm, I've used my abdomen, I've used my leg, I've had an artery removed from my left arm to blood supply. This part of my arm was used to lengthen my urethra so I could go to the toilet properly. It's complicated.
Yeah. And you think, don't you, for yourself, somebody like yourself that's been through those types of complex operations that are going to need recovery, that's a real conviction, isn't it, in your head to have to go through that, the physical aspect, the physical pain as well, and the recovery and the medication and the, so if people have got any doubt about kind of, oh, well, you know, as you've just explained it, oh, well, you know, anybody can go to the doctors these days and get this and that done. You've just explained there that 10, 11-year journey,
Yeah.
you know, and how complex it is and how,
Yeah.
you know, I think hopefully that gives people some of that insight into, you know, how determined as well you are to see through the, you know, the journey.
Oh yeah, you've got to. Sometimes people say to me, "How did you manage to get through
Yeah,
this journey?" And
Yeah.
and you know, I don't really know the answer to that.
yeah,
But obviously, I found some kind of inner strength
yeah,
and just determination and resilience
yeah.
that got me through it, because I went through some dark times
Oh, yeah.
during the surgical process. You know, times where I thought, I'm never going to recover from this.
Yeah. I was going to ask about that. I was going to ask about the breast surgery. What did you call it again? Sorry.
So, chest reconstruction.
Chest reconstruction.
Yeah.
And then obviously the abdominal and then the penis as well.
Yeah.
So what, obviously, I think women that are watching,
Yeah.
you know, or women that have had mastectomies and things like that would be able to understand a little bit.
Yeah.
But I guess there were emotions around that, weren't they? Around kind of, or were they? I don't know. When that happened, when the breasts were removed, what were the thoughts and feelings that you had?
Yeah. I mean, obviously, that was my first surgery, because generally,
Yeah,
for trans men like myself, if you're going to go through surgery, it usually starts with chest surgery, and then you kind of move on if you want to have lower surgery. So that was my first surgery, and I just remember, because for 5 years before that surgery, I'd been binding my chest.
yeah,
To help with the dysphoria that I had, to try and hide.
which is really common, isn't it?
Yeah.
Really common, you know.
Yeah.
And I've worked with young people that have done that as well. You know, putting bandages or really tight kind of things around to flatten the chest,
Flatten the chest.
to you know to not appear to have breasts.
A female body shape.
Yeah.
You know, and it's a risk as well to do it, you know, because it is like a compression.
Yeah.
It does affect your breathing.
Yeah.
And, you know, sometimes like I did, we're binding 24/7.
Yeah.
So after 5 years to finally get my chest surgery,
Yeah.
I just felt elated. That was the emotion involved for me.
Yeah.
I was just elated. I had a really good surgeon who gave me lots of advice about building my chest up even before I had chest surgery. So I was going to the gym, lifting weights.
Right. Okay.
So that when obviously my chest was removed,
Yeah.
female chest, you know, that kind of muscle definition was already there.
Yeah.
And again, that helps with making you feel happy about how you look.
Yeah.
But I just remember after having the surgery done, how just this euphoric feeling of getting up in the morning and having a shower and just being able to put one layer of clothes on.
Yeah. Yeah. Just the practicality of that. Yeah. Yeah.
Yeah.
I think what I was asking, I think the reason I was asking that was because obviously some people will go through this journey, have a family member or a friend, and I just wondered whether almost like it's like there is a turning back, but it's almost like that's a significant step, isn't it? So it's like, did you worry before? Did you worry after? Did you, you know, was it just pure, this is what I've always wanted. I've had to bind for this long.
Yeah.
And, so it was more that than any.
More that.
Yeah. That's interesting.
I think because obviously my journey's been kind of lifelong, and it's like you're building up to this.
Yeah.
And when I finally got there, it was just like, I am so ready.
Yeah.
For this, I need to do this.
Yeah.
And afterwards, although it's an intrusive surgery, it's a difficult surgery to recover from.
Yeah.
So I was really ill after it. I remember that, and it's a struggle to be able to get back to normal life. But the euphoria just overtook all of that for me, because it was that first step in the right direction of having my body exactly how I wanted it to be.
Well, that's a really good insight, isn't it, for people? You know, I keep saying people watching and listening, but you know, that's why we're doing this, aren't we? We're doing this to educate and to make people more aware.
Yeah.
But people wouldn't grasp that, would they? They would make assumptions. Some people, you know, or they might not know how to approach a situation with one of their friends or family. But I think that's a brilliant insight of somebody that's kind of experienced it. There are ups and downs, you know. And obviously you've got that recovery. It's not all roses. It's not all, you know. There's a real process, a pain process, and a recovery process to go through, isn't there?
Yeah, it's like with any surgery, you know. You know, it's high risk.
Yeah.
You know, you're going under general anaesthetic. You know, there's that fear: am I going to come out?
Yeah.
There's all of that going on, but it's almost like this overwhelming feeling of finally this is happening to me kind of overrides it.
Yeah.
And even the recovery, it's painful.
Yeah.
But you think, but this is another step in the right direction.
Yeah.
You
It's
know?
like one step at a time. Did you ever worry while it was coming up to these kind of operations? Did you ever worry that the plug was going to be pulled, or it's going to be, because you wanted something for so long? Did you worry that it was going to be taken away? Were you almost like kind of, I've wanted it for so long. It's took so long to get where I want to. Something's going to pull the plug. Something's going to happen.
Yeah.
Yeah.
Because you do experience sometimes cancellations of surgeries.
Yeah.
And I'd heard about it happening to so many other people. So I used to pray and manifest so much, please,
Vision boards.
please let this happen. It's got to happen.
Yeah.
But even right up until the day,
Yeah.
when you're booking your train travel, because all of my lower surgery took place in London.
Right.
So you're booking your train travel and your accommodation, and you're thinking, I hope this is going to go ahead.
Yeah.
Right up until the morning, to be honest, that it is actually happening.
Yeah.
Is that fear that somebody might take this away from me.
Yeah.
And then it happens, and you're just so happy. And,
Yeah.
Yes, I'm not going to deny the recoveries are tough.
Of course, yeah.
And you do have to dig deep.
Yeah.
And you do need support around you. I always say that to people. You can't do this alone.
No.
It's even practicalities of who's going to get you shopping or pick your prescriptions up, change your dressings. I remember one day I'd had, so this is a full thickness skin graft here, so I needed another piece of skin from my leg to cover this.
Right.
So I had that and my leg bandage at the same time. And one night I was sat at home and everything started seeping out of the bandage. I was at home on my own. I didn't know what to do, started to panic. And my twin sister came round and checked it over before we could get a nurse out. And she said, I don't think it smells right. And I was thinking, is it infected?
Yeah.
And, before I could get a nurse to come out, because I was housebound, I couldn't drive, she changed my dressing for me. And, I couldn't have done that for myself.
Yeah, so you've got to have that support network around you.
You've got to have that network, even if it's just mentally to keep you going.
Yeah, because some people haven't got that, have they? Some people don't feel like they've got it. They do feel, as you described, maybe on their own in the journey.
Yeah.
What kind of support can they get? Who's out there that can support people in that situation? Because not everybody's got a close family or close allies, have they?
No, I mean, I think, you've got to have a strong link and connection to medical care in your community. So, it's really important to have that buy-in from a GP practice or practice nurses, because they are the people, the professional people that are going to be looking after you. I had great support from district nurses that would come out and change dressings, but even just close friends. Not everybody's going to have a family network.
No.
But even if you have one or two close friends that you can call on, to say, look, can you pick me some things up? Can you come round and just check this looks okay? Yeah. It's just, making sure you don't need loads and loads of people. No. But one or two kind of good.
And I suppose it's quite personal as well, isn't it, that recovery and those operations? So you don't want to be overwhelmed with too many people, because I suppose that would get a bit much, I think, on your road to recovery.
Yeah, because it's a very intrusive surgery. We're talking about genital surgery, aren't we?
Yeah.
And I can even think of a funny situation when you talk about family support and what you want family to do. Yeah. And I came home from one surgery catheterized. Again, another medical concern that you have when you've got a catheter. You come out of hospital and you're having to look after that, the infection risks and everything. And I remember one day my dad came round to deliver my prescriptions and my medications because I couldn't go out. And we were just sat there chatting like we are now. And my catheter just came apart. And it was just this feeling of like complete panic and embarrassment. And I'm running away. But then when I came back, my dad was like, it's fine, everything's okay. Everything's sorted. Everything's cleaned up. And you just think, there are a few people in your life that you can rely on to do those sometimes personal things.
Yeah. No matter what,
No matter what.
That's interesting. When we first started talking, you were talking about obviously the disclosure to your mum and dad, and then everything that's gone on in between that, and then there's that situation. You know, that's an example, isn't it, of how far people, you know, in your life have come with you.
Yeah, it certainly is, and that's why I like to talk about it, to show people that positivity, that things do get better, and it does need patience.
Yeah, absolutely.
And everybody's got to go at their own pace, but things do get better. And when I look back, certainly to my medical journey, and those difficult times, like not being able to pick prescriptions up, or needing somebody to come and visit me with shopping, it was probably my dad.
Yeah.
And, you know, that was a person who at the beginning found it so difficult to come to terms with. And slowly but surely, both of my mum and my dad, you know, the correct name was used, the correct pronouns were used, and we started to celebrate who I actually am.
Yeah, because they've been on a journey, haven't they?
They've been on a journey.
Yeah. So tell me, there's a couple of things I wanted to discuss before we kind of close the podcast. I could just sit here and talk to you all day about this, and I'm sure people could listen as well and watch. I remember you speaking at the college about the actual, you know, these are the things that people want to know, you know. So, you know, the construction of your penis then. So what discussions do you have? You know, what decisions do you make? Do you have a display cabinet of penises that is this what people will,
ask me
will make assumptions, won't they? And, you know, tell us a little bit about that, because I know that some people will be interested to know, you know.
Yeah, because it is an unknown.
Of course.
And, you know, it is really important to say that not all trans people want to talk about their personal journey. Yeah. And I always say that to people. You might speak to a trans person and they don't actually want to discuss the ins and outs of their surgery, and that's okay. Yeah. But for me, as a trans speaker and an educator, I do get asked questions, and there's nothing that's out of bounds for me, you know, because I want to educate people.
I mean, obviously we know each other, and I've worked with you with, you know, presenting in a few places that I've worked with our young people and our staff. So I know that you're okay to talk about this. So that's why
I am. And you know, talking about young people, I remember when I was still in the police, and I used to do a lot of drop-ins at youth centres. Yeah. And I went to the Young Persons Advisory Service in the city centre. Yeah. And they specifically wanted me to do a session on trans men's lower surgery, because there's young people there that want to know the answers to it. Yeah. Because actually, when you start to look into this surgery, there's not a lot of information out there. No. So I think it needs sometimes people like me to talk about it. Yeah. And what was really important for me was, let's be honest, you know, I'd waited a long time for this surgery, and the things that were really important, and you get asked these questions as you're going through the referral stages. Well, what's important to you? And the fact that my penis is aesthetically pleasing is important to me, that it looks good. Yeah. Functionality.
I think that's important to everybody, isn't it?
It's, you know, and why wouldn't that be important to me? Yeah. Functionality. So it was always important for me to be able to go to the toilet. Yeah. As I should be able to. And sexual function. Yeah. So sometimes one or a couple are important to people, but everything was important to me. Yeah. So going through the various kind of decisions, all of that came into it. Yeah. You know, and I remember with one of the procedures that I was going to have but didn't have in the end was a procedure called radial forearm phalloplasty, which is what most trans men have. But because my forearms are not massive, they said that the size wouldn't be great. Okay. And so that was an important decision for me, because size is important to me.
It's important to everyone.
So that was a decision. I wanted to be able to go to the toilet normally, so I had urethral lengthening, which is what I use this part of my arm for, so that I could do that, and sexual function as well. Yeah. So I went on to have like a pump in the scrotum, which means that I can have sex like anybody else has. So all of those decisions were important, you know, to me, even down to my last stage of surgery took place just before, it should have been my last stage just before COVID.
Okay.
And in that stage, it should have been finalised. But when I came out, I was told that they couldn't quite fit the prosthetic testicle in. So you have a pump one side and a testicle the other. And it was too much of an infection risk, so we'd have to try again. And then COVID happened. And a lot of people, including the surgeon, said, well, do you just want to not bother? And I waited another almost 3 years to have the testicle implant put in, because that was important to me.
Yeah.
So every aspect of it, aesthetically and functionality, has been important to me.
Yeah.
Because it's completed me as a person.
Yeah. No, I think that comes across how you never wanted to do half a job, did you? You wanted everything, didn't you? You wanted everything you wanted to be 100% happy.
Yeah.
Because I'm guessing that if there was some aspect of it that you weren't happy with, that would have played on your mind. You would have thought. Yeah. You would have felt some sense of failure, maybe. I don't know.
Yeah, and just not feeling that. Yeah, that completeness.
Yeah.
Do you know? I always say to people when I deliver presentations, they always say, do you know, that last surgery that I had when I crossed my finish line, as I described it, it was the 27th of June 2022.
Yeah.
And I come out of surgery in London. I got back, obviously I wasn't feeling great, but I took a selfie, which I kind of absolutely treasure because I felt so happy. But much more than that, it was actually the first time in my life that I'd ever felt complete as a person.
Wow.
That's how I felt.
Yeah.
And that feeling and that moment will never leave me. You know, that's how important it was.
Yeah, that's interesting. And again, you know, people wouldn't have heard this before, this real honesty and, you know, obviously the physical aspect. So can you tell me, like, you know, obviously once your surgery had been done, or even at midway point through different surgeries, practically, you know, like even like, did at any point were you like, I'm holding something to go to the toilet, you know, that sense of, was it kind of pinch me moments almost where you were like, or did it just feel natural, or did it feel a bit strange at first?
I think probably a little bit of a mixture of everything, because it's a huge kind of process to go through, isn't it? Do you know, the lower surgery itself took nearly 6 years, broken up over stages of having a body part but no functionality, and then another stage where you get a bit more functionality. So it's very slow, and there was a lot of frustration because I just wanted it to be there and be able to use it and everything to be finished, and it wasn't. So at the beginning, I think it did feel a little bit almost alien. Like it's like, that, I think that's how I'd describe it. It's like this body part is just stuck there. But I can't do anything with it.
Bit like when you get a new car or something, where you're just like, you know, having a look. You know, you open the curtains just to have a look at your new car. You know, you're like, bit like.
But I remember that exactly after the first stage in London, and the nurses came to check on me, and they went under the covers, you know, check everything was okay. But you can't actually see anything because there's bandages and bandages. And it's about a week before you can actually see anything, and then for the first time you go, wow, like it's there. Do you know, because there are things that go through your mind, like, is it going to drop off?
Well,
do you know, things like that? It might sound really strange to people, but so you go through different stages, and then it takes a while to kind of adjust and fully get used to everything. And then it's almost, I don't know, all of a sudden everything just kind of drops into place. But I would say it was even right up until the last stage, having the testicle implant, because I didn't feel like everything felt fully right until then, because you'd be surprised how much of a difference that makes going from.
I mean, it's really hard to kind of. I mean, obviously, I've got a penis, but it's always been there. It's always been part, you know. So it's really hard to try and get into your head and your headspace to understand what that was really like. And I think people watching and listening will be like, God, what must that be like? You know, like, and it, you know,
it's just and again, you know, because we talk about dysphoria and unhappiness a lot, don't we, when we talk about transgenders? But there's so much euphoria that goes through the journey of surgery. Because all of a sudden you're looking at yourself in the mirror thinking, oh my this is finally me.
Well, they say that, like obviously people get boob jobs, don't they, and things like that, and other surgery, and they'll go through something similar. But I imagine this is times by 100. When you've wanted something for it hasn't been like you've thought, 12 months ago, I'll have a boob job, or I'll have a, this is something that you've wanted for, however long you can, 50 years or whatever. Nearly.
Yeah.
So that euphoria must be. So people that are listening and watching, they must be like, well, yeah, I know what that's like, and I know, but this must be accelerated by 100, 1,000. It must be like, yeah.
It's because it's another body part, isn't it? As well as all the functionality it gives you. Because for me, I always wanted to stand up when I went to the toilet. Yeah. And all of a sudden you can. Yeah. It's these things like, that even as a child,
I every now and again do a sit down week.
But it's kind of all of that, kind of, and it's even things like, as I do a bit of running, and when you're running, your body feels completely different. It's there's so many different aspects of it that having that body part there, it's life changing. Yeah. Certainly for me. Anyway.
And what's interesting about this is that you've explained all the emotions, haven't you, of going through this journey, and obviously in the last episode we talked a lot about work and your career and when you were younger, how you felt. There's so many kind of emotions throughout this journey, but I think it's really important that you talk about the happiness of it as well, that real euphoria. I suppose my question to you is, I know people chase euphoria, they chase that buzz, don't they? Mm-hmm. How do you beat that? How do you beat that euphoria that you felt?
I think that's a really good question, because people spoke to me when I was going through the whole medical journey and the surgery, that for some people, once they finish it and it's complete, there's almost like a void. Yeah. And a feeling of emptiness, because this has been going on for so long, and I was a little bit conscious of that. But I think when mine was complete, it's just enhanced my life so much that I've now moved on to other adventures. Yeah. It gives me a lot of joy to talk about it through my education and my speaking, because I'm now using this journey to make a difference to other people. So I use that to continue the euphoria. Yeah. But also, I'd made a lot of sacrifices. Yeah. Like relationships. Yeah. And meeting people, because I couldn't do everything I wanted to do. Yeah. And I was always conscious. So I suppose that's been a new adventure in my life, is dating. Yeah. Meeting people. Yeah. Having sexual experiences. Yeah. That I've not been able to explore. So I've kind of filled...
No wonder you're happy.
I filled my void, which I thought might happen. It never did happen. Yeah. But I filled that with like new adventures. Bro. That I can embark on because of what this journey's given to me.
Brilliant. Well, it's such a valuable insight. I mean, I've spoken to you about this many times, but to actually speak to you on the podcast and to get that to really dig deep into it and get that further insight and that further information, for me, I think it's been absolutely brilliant, and hopefully our viewers have really learn from that, your journey, and actually the realities of it, and not, hopefully some people that didn't know about it will hopefully, have learned from your experience and will not, like assume things, or maybe somebody that they know is experiencing, going through that journey. So thank you so much for coming on the podcast. I've just got one last little thing, and I think it's a nice way to end, actually. I just wanted to ask you about your dad. And about the birthday card.
Yeah, so obviously we've talked about my journey with my mum and dad, and them coming to terms with me as their son, because I'm their only son, and they didn't have a son before me. And I think for such a long time in the journey, because it was so difficult, I'd always really hoped one day that I'd get a son card for Christmas or my birthday. And I got that after starting transition legally in 2012, and actually telling them I got that card in 2020. And when I opened it, it was just such an emotional feeling, because I put myself in their shoes at that moment, and I knew what it had taken for them to get to that point, to actually go out to the shop, to buy a card.
Sounds like something so simple, doesn't it? But
and I always say that to people, you know, that have had a son card for their birthday or Christmas. It probably is something you never think about. But for me, I knew what that had taken. And to write that card for me, that was their letter of acceptance.
yeah,
For me as their son. And every year after that, I've had son cards throughout, and it's meant the world to me. And you know, we touched a little bit on that grief and, you know, what they've been through and me not really understanding. And you know, as you know, I lost my mum last year.
Yeah.
On the 30th of September, and I really have been consumed by grief, and I know what that feels like now, and I now think about what they were going through.
You reflect that with your situation.
I compare that to my journey, but right up until the moment that I lost my mum, I could feel a love and acceptance for me as a son.
Yeah.
And in fact, that was probably the last conversation I had with her, you know, when I held her hand, and she, well, the last words that she said to me were, "You're a good lad."
Yeah. Which
so
is
even
amazing,
right in that moment, she was validating me and her acceptance of me.
Yeah.
So I'm really lucky. I'm really lucky that I've got to a place in my life where my parents and my family love and accept me.
And that card as well, that it's a real representation of that journey, isn't it?
It is.
And obviously what your mum said as well.
Yeah.
And I think, you know, again, I keep talking about people watching this and absorbing this, and they've obviously been through a long journey, a big journey, haven't they, with you? And people shouldn't forget that, you know, when they're being disrespectful or they're being negative or they're making assumptions. There's a lot of people involved in this, and it's people have got friends, they've got family, and most importantly, the person themselves. Yeah. So I think what you've done today is, for me, is really powerful, and I'm you know, grateful really for you coming and talking about that. I mean, we've sat for a good couple of hours. I'm sure we could sit for a couple more. We'll have to do a part 3 and 4. But no, I'm really grateful for you sharing your story. I know it's really personal, and you've exceeded my expectation. I already thought you were brilliant, but these 2 podcasts I think have really, you know, opened up, you know, hopefully, you know, more conversations about this and the reality of that transgender journey. Yeah. So thank you for sharing that with us, and hopefully we'll see you again soon on the podcast.
Thank you so much. Thank you for helping me to kind of share my journey to others, because it's really important that people hear those lived experiences, isn't it?
Real. So just this definitely is finally this time. Have you got any resources or any place that you can? Obviously, you've got your own website, haven't you? Have you got anywhere that you would point our listeners and viewers to with regards to resources and information if people want to know more, or they want to, you know, maybe share some information with a friend or a family member?
Yeah, I mean, there's some fantastic resources out there, you know, in Merseyside, but regionally and nationally. So what I would say is definitely look for those resources. But here, you know, when we think about Liverpool and Merseyside, we've got a resource called Sea Magic, which sits under Merseycare, which is a pilot scheme, and it's one of 3 pilot schemes running across the UK that alleviates some of the pressure from the national gender clinics, and they provide fantastic counselling and holistic support. So I would definitely say look into that. The trans support service here again in Liverpool, but organisations for young people such as the Proud Trust in Manchester, Young Persons Advisory Service, Over the Rainbow in St Helens. They offer a fantastic group for young people who are LGBT+, but also a fantastic drop-in for parents and carers of trans young people. Brilliant. It's quite a unique group, so to have it here in Merseyside. So I would definitely say check out some of those resources.
Superb. And what we'll try and do at the end of the podcast is put those links for those resources. So again, thank you so much, and thank you for sharing your story and your journey. I've enjoyed it immensely, you know, and we always have really honest conversations, don't we? So hopefully our viewers have as well. So thanks everybody, and thanks for tuning into the Great Schools Trust, the Great in You podcast, and we'll see you next time. Thank you. Bye-bye. Thanks everybody for listening to the Great in You podcast. We really appreciate your support. Please like, subscribe and share, and the podcast will be available on Spotify, YouTube and all other social media platforms. Thank you so much. See you next time.